Hey everyone, welcome back to the BioNexus Health podcast, Autism Uprooted. Today we will be speaking with Resi. Resi is from the Philippines, recently moved a couple of years ago, I think, to the United States. And it's very interesting that her teenage daughter was diagnosed with autism. I mean, extremely unusual to get a spectrum diagnosis in the teenage years. And we should find out as we speak to mom how environmental toxins and biological toxins, may have led to this erroneous diagnosis. And Resi's daughter has made tremendous improvements by leaps and bounds almost within a few weeks of starting the BioNexus herbal protocol. So let's go ahead and welcome Resi to today's podcast.
Welcome to the BioNexus Health podcast with Dr. Jodie Dashore, who holds a PhD in integrative medicine, is board certified in integrative pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health podcast, Dr. Jodie Dashore.
Hi, Resi. How are you? How's California today?
Hi, Dr. Dashore. I'm good. Yeah, it's a good weather right now here in California.
Yes.
So yeah, nice to see you.
Nice to see you as well. Thanks so much for being here.
Thank you also, for guesting me here in your podcast.
Oh, of course, yes. Your daughter in her teenage years was diagnosed with autism. So, how was that experience? I mean, can you tell us a little bit about how does that even happen? How does someone get diagnosed with autism in their teenage years where, she was doing fine, and then what exactly happened?
So just to start with, like 2019, we migrate here, and then she's doing well. She's doing well in the school, and then after how many years, we moved to a house that I never aware of molds before, and then it started with after 3 years, it started with a brain fog, and then the school psychologist just noticed it for my daughter, and then suddenly she's not looking like an eye contact. She loses her eye contact then, and then sometimes she just she doesn't recognize that she hit I mean the post.
How old
Sometimes
was she? How old was she?
we moved here like she's the 2019, around 9 years old.
She was 9 years old when you moved to California from the Philippines.
Yes.
Right. And then you moved into unknowingly into a mold-filled home that had a lot of mold in it. And 3 years after exposure, she started developing brain fog.
And then also the one like I noticed she complained like because 2 years she's doing well in the school. She had like good grades, and then suddenly she complained that, Mom, I cannot understand what I'm reading, because she loved to read book at that time.
Wow.
She doesn't understand, and then
She was 12 by then, right? 3 years.
By 12. And then whenever like she started like staring spell, I mean she's staring, and then we just need to tap her to just communicate because she's just staring. And then after that, she was rushed in the emergency because of the psychologist, school psychologist, or social psychologist there told me that my daughter has this suicidal thought.
Oh my goodness. Okay.
And then I rushed her in the emergency last May 2022. So in May, she did like 2 emergency, and also she went to a behavioral, like a hospital to examine her, what's going on with her. And
she
then
was hospitalized in the
in a
psychiatric.
it's a behavioral, like,
behavioral.
yes, just to determine like why she's thinking of the suicidal. So, and then she's thinking like nobody likes her. Some like they said it seems like psychosis again like that. And then start with the depression. After releasing, she gave her medication for to stabilize her mood. And then after that, just a month, she started anxiety. One by one, the symptoms.
Depression, and so in spite
It
of
started with the suicidal. Yes, it
oh,
started with the suicidal, and then suddenly depression. She just crying and crying without reason.
mhm.
And then she said, I want to die, and like that. And then I don't know what's the reason. After that, this anxiety attack, the panic attack. And while he, and then after 10 days, she they release her in the hospital.
Okay.
So one by one, I noticed while she's taking medicine, she has this unwanted or unexpected movement of her muscle or under her face or what. It's like a tick and keep washing her hand. She think that she had a lot of
And
germs.
OCD. Yeah, okay.
And then the last one is OCD.
Okay.
Yeah. So the symptoms is not just one, but just coming and coming, even though we keep on increasing the medicine for anxiety.
So the medicine for anxiety was being increased, right? Psych meds were being increased, and she still developed motor tics,
Yeah, she developed a lot of
OCD.
symptoms, a
Okay.
lot of panic attack. And the last I remember, she's been in the emergency also for a suicidal, like August 20 last year, 2023, right?
2023.
Before I met you.
Yes.
Yeah.
And then you heard about me, and you wanted to proceed with a natural treatment.
Yeah, then the school just assessed her for autism
For
then
autism.
because not yet, because the diagnosis from the hospital is not autism, because they said she's doing, I mean, they can talk to her,
Hmm.
but like that time she doesn't have she doesn't have the hand flapping. Then the hand flapping shows.
The hand
So
flapping started. Okay.
before I met you, like it started to show one by one. And then so the school psychologist assessed her for like behavioral, and then they said it's a autism, or they're not giving like exact because they're not allowed, but like the assessment, it's a spectrum.
Yes, so
And
she was diagnosed as being on the spectrum. Okay.
yes, so I didn't have a chance for official diagnose that time.
Yes.
And then from then I find like a natural medicine for autism, because I am not aware for autism. And then I found you with Karen for
Yes, yes. So, how was her language? How was your daughter's language? What was the decline in her speech and language that you saw as she went into this depression and spectrum behaviors and diagnoses? Um, if you can explain, how the language decline, how did the language regress in any way?
Yes, before she's not like that, because at the 9,
The
she's
normal 9-year-old, right? She
yes,
was
she's
a
kind of
neurotypical 9-10,
matured.
right?
Yeah,
She was mature. Yes.
but I just noticed like she started like age regression. She's acting like and then language she speak like repeatedly. I mean, one word again. She asked repeated question. Assurance of because of the OCD.
The
Yes,
anxiety, the
have
OCD.
anxiety.
Yeah. You saw age regressions. Like she started behaving like she was much younger. Like how younger?
Yes. Oh, I don't know, but she, I think five younger, or yeah, 5 to 7 younger is.
Okay, so she started behaving like she was a 5 to 7 year old
Yeah,
instead of,
and she doesn't have like a social cues whenever she want to speak whatever she want. She don't have like, yeah, control,
no filters.
no
She,
filter.
right, she lost the control. Okay. Her language became immature as well. Language regrets
Yes.
the words.
Mm-hmm.
Okay. I remember listening to her, her tone of voice also changed, right? She became the way she spoke was like a baby tone of voice
Yes.
in the
Yeah.
when I
Yeah.
first met her.
Mm-hmm.
Yes. All right. So then, we met, and I was, of course, happy to have you on board. It was very unusual to have an almost teenager being diagnosed on the spectrum, or suspected as being on the spectrum, and all of this age regression, etc., that you mentioned. But the key here, the key would be the environmental
Yes.
factors, the
Mm-hmm.
mold issues, and so we did all the labs, right? And we found a lot of issues. How did you feel when you saw everything that we found in the labs we ran for her?
I didn't expect that because she's been in the emergency. So they did the MRI,
Yes.
they did the
Blood
spinal
test.
fluid test,
Oh,
blood test
okay,
for
spinal tap
neuro.
was done as well,
Yeah,
right?
the first emergency she had, and then nothing in the test result. So they just, suggest or recommend me to find like more on the behavioral or yeah, more on mental health.
Right, more along the lines of mental health versus actual medical condition,
Yes.
which is chronic inflammation and brain damage, which comes from mold. This is so important because I've had other patients, that have attempted suicide at an older age, in their 20s, in their 30s, and, uh, they've assumed and they've been told it's because you have chronic illness, it's because you have depression, you have poor mental health, poor mental hygiene.
Mhm.
That's the reason why you're having suicidal thoughts. And it just that is just not necessarily always true. You have to look at other factors, right? I mean, and anytime there is mental illness doesn't mean that you keep increasing the dosage of the psych
Mhm.
medication. That is just, I think that moms and dads and people themselves are becoming more aware, which is where, you
Yeah.
found me and you wanted to investigate further. So I'm glad we ran all the labs. I mean, it's her labs, it's black and white. Uh, good. So I gave you a customized protocol for Maria.
Mhm.
And how soon after starting the BioNexus herbal protocol did you see any changes, and what were the changes?
Yeah, so the first changes I noticed with her, like the hand flapping decreased, and then she's more like focused.
More focused?
Yeah, but like it has also the die off you shared in your podcast sometimes. Oh, I need to just drop small amount of the medicine just to control. But yeah, it seems it has still even like a small dosage because of her, yeah, a lot of symptoms, right? But after that, just continuing with the medication for how many months? She's been like, now she had a lot of communication. She can communicate well. She can cook. She can, yeah. Now this time I am teaching her, or she is eager to bake her own organic gluten-free bread, or Yeah.
Oh, she's baking. Look at
Yeah,
that.
this summer,
Right.
yes, she started to bake her own, yeah, pancake, but gluten and organic free. She also like aware of what she want to eat. I mean, she need to eat like she just like organic. She's always asking my family, is this organic? Is this gluten free? Also the guts become because you gave us like for the gut to support her guts, right? Yeah, she's doing well on her guts. And
Okay.
then what else? Yeah,
So
she
let's see. So she had cognitive improvements with
cognitive
focus,
improvement.
right?
Yes.
Focus and language. She came out of that being in her own world. Eye contact has improved, right?
Yes.
She's talking normally again. She's her language has normalized.
Her language sometimes she can talk like normal, but she feels like talking like a yeah, just changing her voice. But I am just yeah, tapping her. Oh, your voice. You just need to talk a normal voice, and then she
Oh,
can
so
do it.
she's able to. That is good. I remember with my son as well. Up until the age of 8 or 9, we had that Mickey Mouse voice, that baby voice, which would,
Mm-hmm.
and it's not something they can control because, there is
Oh,
PAMS, pandas, basal ganglia damage, there is gray matter atrophy, there is white matter in the brain, there's edema or swelling that happens from mold exposure and other environmental toxins. It's not just mold, right? When you're living in
mm-hmm.
a moldy environment, there are so many other toxins and bacteria, actinos and endotoxins that come into play, and those affect the health as well. So it's a big deal that she's able to change her voice quality back to age appropriate. Uh,
Yes.
so,
Mm-hmm.
so her brain is starting to heal. When I gave you neurological support level 2, that level 1 brings inflammation down, and neurological
Oh, okay.
level 2, it starts to repair the damage.
Okay.
So I mean,
Yeah,
herbal
I
medicine can
am.
do all that.
So I am really like thankful with the medication protocol because it's really, yeah, I see a lot of improvement. Even her, whenever I am telling her about you, oh, she said, oh, I have a podcast with you. Oh, really? She's excited.
She was excited about the podcast today. That is
And
that
then
is
because she
wonderful.
wanted, yeah, her
Yes.
experience, she want to, yeah, and her improvement. And then the last like school year. So before her grades felt like turned to F grades because of her focus. But the last sem, I mean, yeah, the quarter, she got all her grades well. So
Oh,
she
she
passed.
got good. Okay, all right. So she
She
was
passed all her grades. Yeah,
okay.
from F to like B. Like yeah, she
Wow.
passed. Yeah,
From F to
but
B.
yeah, her math is A. I think A plus or A.
Her math went to A plus from an F. I love it. She's always been an amazing child until she got exposed to these environmental toxins.
Yes.
She was always
Yeah.
bright.
Yeah.
Now we are back to that. Resi, last time when we had the appointment, I remember uh, how quickly and efficient, right? Maria woke up, she went to the bathroom, got ready, got dressed, she got her book bag, bye mom, bye Dr. Dashore, I'm off to school. That was like, okay, it's normal 13-year-old. Like
Yeah.
I did not see any major issues. Her mental health has improved as well.
Mm-hmm.
Yeah,
Yeah, I believe
so
so. And
happy.
then yeah, she can like now I can tell her, oh, wash your the bottle she's using for the protocol, the medicine. It's just the one like after drinking your medicine. So you need to wash your bottle. So she's cleaning. And also our kitchen, yeah, she's the one cleaning her table every morning. That's why.
Yes.
So
So
yeah.
look at that. She's helping around the house,
Mm-hmm.
she's running errands, she's going to school on her own, she's getting good grades now. She's
She can
mentally, she's
bake, yeah.
no hand flapping, no.
No
Wow.
hand flapping.
Okay. Okay. That is just, I'm happy to hear that you experienced die-off, I mean,
Mhm.
die-off is not fun to watch because it's your child, but you have to understand, keep in mind that die-off means that the medicines are working. Not everybody gets die-off, of course, but when you do, then you know that number one, infection load was very high. Number two, that the medicines are working. They're on track. That's the reason why, her brain improved, her gut improved, behavior improved, independence, cognitive, language, what else? Mathematics, all of these things. Resi, being a 13-year-old girl, neurotypical, is hard enough. But at least in the United States, I think pretty much everywhere in the world, being a teenager is really hard with all the hormones, and especially for girls,
Yes. Mhm.
right? And then for Maria to go through all of these additional challenges, it must have been so hard. And I'm really glad we found each other and we were
Yeah.
able to help her.
Yeah. And also like, yeah, you mentioned about like yeah, hormonal. She
Yes.
had also like the premenstrual it's like that whenever she had a period 1 week before or days before, she's difficult. But when we had this protocol, it really like, yeah, just natural. Sometimes she doesn't know that her period coming. But
Okay.
before it's really, yeah,
Yeah, really
a
bad.
lot of drama
Oh,
and difficult to, yeah, to talk to her that time. She's having some, yeah, behavioral also. But right now, yeah, she knows when to come, and then she just, yeah, just oh, my period coming, I can feel like that. But like the drama or the, yeah, the behavioral was, yeah,
that's all gone, and
yes.
she's experiencing, yes, many young girls
Mm-hmm.
experience a lot of very toxic hormonal issues because of environmental mold toxin exposure. PCOS can happen.
Mm-hmm.
Um, I've heard, I've had so many reports of PCOS, some early signs of endometriosis, a lot of extraordinary pain during the cycle for young girls. And that's
Mm-hmm.
just, and the awareness for environmental toxicity is increasing, but it still isn't fully there. I mean, no one
Mm-hmm.
told you that, all of this is not mental health, but it may probably be the environment. Why don't you check the environment? Why don't you
Yeah.
run some labs? Because if the immune system becomes compromised, so, you guys were exposed to mold. And for your daughter, she experienced a severe decline. And as the decline is experienced, that affects the immune system becomes dysfunctional as well, the innate immunity, the adaptive immunity. And when immune system becomes dysfunctional, there are opportunistic infections that come into play. There are other toxins that start to
Mm-hmm.
accumulate in the body. That is why you have to run the proper labs. And then, it sounds so logical, but it is rare. With me as well, Resi, for Brian, my son, we had to visit 19 specialists in 4 or 5 different countries to be able to understand what is going on. It was just mind-boggling. Everyone's giving us their, oh, it's mental. Oh, he's pretending. Oh, it is just, something he'll grow out
Yeah.
of. Oh, it's asthma. No, it's not.
Yeah.
And all they could give us was try steroids.
Mm-hmm.
I don't want to just blindly try steroids for my son, and the worst thing was I had an Ivy League infectious disease doctor telling me that Have you considered, maybe it's just drama, maybe he's just pretending? It's just
Yeah.
some of the things you hear are just
Yeah,
ridiculous.
I experienced also to like one of the doctor, then she's just keeping saying, oh, you need to coordinate with the psychiatrist because they like because the your recommendation is for the psychiatrist. But I told her I already working with her for how many months and years, and then keeping increasing the medicine because I just want to have referral to some doctors for specialist or for pans or for neuro. That's why when they ask for like for the hospital that has checking for pans, it will take like 1 year, less than 1 year to wait. So I decided myself to find my to find a doctor directly. So that's why I keep on searching, and then we found each other
Yes,
because it doesn't help even though
yes. So they kept increasing her psych meds, and you were not seeing any relief. So where
they're
are
not telling the causes.
yeah, because you were not addressing the root cause
Yeah.
of it. So what's the deal with the meds now, psych meds?
Oh yeah, I want to to share also with you after our appointment. So I asked the doctor to decrease the medicine for the psych med, and then we started last month to decrease the morning. So it's good. I mean, and then after we had an appointment last July 3, I remember. So
Yes,
we decreased the another dose for the one med for the mood stabilize.
yes,
So it's in the lowest dose now, and then after 6 months we can see if for the anxiety keep decreasing and
yes,
decreasing because the symptoms was not there anymore. Yeah,
yes.
only the mild OCD, I told her.
Yes, yes. Yeah, the mild OCD is a symptom of PANS,
Mhm.
and it will slowly dissipate as well. I mean, everything takes time, and as you can see, you were able to get her off the psych meds. I mean, they kept increasing the medication for you. How high can they go? It just doesn't make sense. So now it's the other way.
Yeah, because before when we are not, I mean, before I met you, they tried to decrease that the same med, but it turns like going to the emergency again because of
Oh, she ended up in
but
the
right now but now they decrease, and then now we decrease again the same dose, so she's still
she's stable.
she's stable.
Yeah, yeah.
That's
Yeah,
the
she's happy now. She's happier now as well. Well, from I remember from last time when I spoke with her. That is so
yeah.
nice. I am so happy that we have been able to help Maria, and she can just have a good life ahead of her now.
Yes, thank you, Dr. Dashore.
Oh, absolutely. My pleasure. It was really nice to have met you and have met Maria because this was sort of a unique case for me as well. So that's why I'm glad you're sharing this podcast, your story on this podcast today. And I hope that those listening will understand and will also pass this information on to friends and family that if you have anyone diagnosed with any kind of mental illness, you have to get immediate support, of course, to be safe, but you have to dig deeper. You have to see if there is any other reasons for the symptoms that are being experienced, depression, anxiety, OCD, suicidal thoughts. I had one patient with all of that and homicidal thoughts as well, for the younger sister, and even acted upon those impulses once or twice, and
Mhm.
it was just really hard to believe that a 9-year-old would do all of that. So this
Yeah.
was a little boy, I remember, Jake, from many years ago, and same thing. He was diagnosed with schizophrenic.
Yeah.
at that age. Like, really? But anyways, he's doing well now, right? I discharged Jake a long time ago, and he's doing really well.
Mhm.
I think he's in college now. The last I met mom.
Wow.
Yeah. So cool, very cool. Okay. Now,
Yeah.
all right, so that brings us to the end of this fascinating podcast with Resi today. I hope it was informational, and I will see you all at the next episode of the BioNexus Health Podcast. Take care. Namaste.
Thank you for joining Master Herbalist Dr. Jodie Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugged. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.